Today, we are talking about something that confuses a lot of nurses, especially international nurses preparing to be a registered nurse in the UK. The differences and similarity between hospital and community scenario in assessment station. Let's simplify this. First, what is the same? Let's start with what doesn't change because this will give you a solid foundation. First, the marking criteria. The marking criteria stays the same regardless of the scenario. Either it is hospital or community. The assessor uses the same checklist for scoring. The second similarity is either hospital or community. Both uses News 2 chart. Yes, if your scenario is hospital scenario, it's going to be the News 2 chart only. However, if it is community scenario, it will be News 2 chart in addition to any other special chart that is peculiar to the station you're given. The only station that News 2 chart is not required, it is only in subdural hematoma where you're going to be using GCS chart. The third similarity is A to E assessment is always required. Either hospital or community scenario, it is always required that you carry out full set of observations on these patients following A to E approach. That is the airway, breathing, circulation, disability, as well as the exposure of the patient. The fourth similarity is holistic approach still applies regardless. Either it is hospital or community, you still need to check ethical, psychological, psychosocial, religion, or sexual need of the patient. Having talked about the similarities, let's talk about what is different now. Depending on your settings, here are what you need to do. First, patient ID and allergy status check. In hospital, you check patient ID bands and allergic wristbands. While in community, there is no use of wristband. So you verbally check the patient's name. You will still ask whether or not the patient is allergic to something, but there will not be any use of wristband confirming that. For extra confirmation, you can further confirm with them their first line of address. The top tip is always check the allergy status of the patient. Do not assume it's been documented. Second point under what is different. Who do you escalate to? In hospital, nurse in charge or the medical team. In community, always escalate to the GP as there is no ward team in community. Report any score other than 0 in both settings. If it is in hospital, report to the in charge nurse or the medical team, and in community, report to the GP. Still under what is different, the third point there is risk assessment. That is, you will always get additional charts to the news chart you've already gotten in case of community. Take for instance, must for a patient that is having diabetes. In this case, you are going to use must chart to calculate the BMI score of this patient, also to determine how much weight the patient has lost in the last 3 to 6 months. Also, to know whether or not the patient has been acutely ill. Act on the score and verbalize your plan. Still under risk assessment, another scenario could be in case of Alzheimer's disease, where CCIT chart is going to be used. When it comes to assessing a patient with Alzheimer's disease using CCIT chart, during your assessment, this form would have already been pre-filled. All you need to do is sum up the score, relay the findings to the patient, and Discuss one or two components out of those already scored points. Then sum up your total. Talk to the patient about your next line of action, such as your support as well as the referral for this patient. Do not be tempted to skip this. It could result into a critical fail. Still under what is different, another point is tailoring your intervention in your care plan to community. Holistic care for a patient may seem the same in theory, but in interventions, it must fit the settings. For instance, if the patient is at home, you should think about arranging for a carer through the GP. You can as well suggest community physio, dietitian, or district nurse. If the patient is in care home, you may want to inform the staff there to assist the patient in any care the patient may require. So referral in community settings must be to the community services and not to hospital department. A quick recap of everything discussed in this video. First, both hospital and community scenario uses the same marking criteria. Secondly, it is imperative you complete News 2 charts in both settings. Next, always do A to E assessments and holistic care in both settings. Next, identify patient verbally in community as there is no use of wristband. The next one, in community, escalate to GPs and not the hospital department. The next one, in community scenario, you need to complete extra chart that is given to you in addition to News 2 charts and educate the patient appropriately. Next, adapt your care plan to fit the environment, that is, to fit the settings. You've got this. Until I come your way in my subsequent videos, keep practicing OSCE. Bye.